Welcome to my friends and colleagues and loyal subscribers of Urology Coding to Learn. I'm Dr. Ferragamo, and I will be your presenter for this webinar. Let's go to page 1, which we have on the screen for the topic, and this is going to be correct coding for urodynamics in 2021. Let's look at office urodynamics. Office urodynamics may be cost effective when done in the office, but you may have a capital outlay to buy the new equipment available for urodynamics, and that may cost you anywhere from $15,000 to $30,000. However, it is estimated that you will have a return on investment in 6 to 12 months, depending upon how often you do the urodynamic studies. Now, the urodynamic studies can be performed by physicians or by trained ancillary personnel, although there is some state restrictions. And then, of course, it is important that you have to ask yourself, are urodynamic studies clinically useful for me in patient management? Urodynamics may be performed by many, but this may vary by the state. Now, in New York State, where I'm speaking to you from, urodynamics may be done by a trained registered nurse, by a trained licensed practical nurse, but you will not be paid, and a medical assistant or medical technician should not do the urodynamic studies. Now, where may these studies be performed, urodynamic studies? Let's go to page 6. Let's look at some revisions for urodynamic and having a urodynamic study in your office. Urodynamic reimbursement code, all the urodynamic studies with modifier 26. Now, all urodynamic procedures can be performed, as we saw on a previous slide, by or under the direct supervision of a physician or under the direct supervision of other qualified healthcare professionals, such as non-provider practitioners or an NP or PA. Let's look at some urodynamic rules for non-physician provider providing the doing or performing the urodynamic study in 2021. Now let's look at some local coverage determination. 51725 is a simple CMG, and we're going to talk about that in a little while. Now, 51726 is a complex electronic cystometric study. And then we have the codes, the 51727, 51728, 51729. They also bundle and include catheterization codes and the code for obtaining the urine for culture or obtaining the urine for a urine analysis. That would be code P9612. Let's look at some urinary symptoms, the ICD-10-CM diagnostic codes that will get you paid for urodynamic studies. These urinary codes from the signs and symptoms sections are typically covered for urodynamic testing. Other diagnoses may be covered as well. Now let's look at some local coverage determinations that have changed in the past years. And there was one which was labeled a number 4. This was changed on August 28, 2006. CPT code, some of the urodynamic coding. The urodynamic codes are in the 50,000 range in the 2020-21 CPT manual. These codes have a 0-day global. They follow the multiple procedure reduction rules. For multiple procedures, you may have to use modifier 51. If you bill an E&M service along with the urodynamics, the E&M service will require a modifier 25 for payment. Now let's look at some urodynamic coding changes. Now these changes occurred a while ago. These major urodynamic coding changes occurred in the year 2010. 3 new codes were identified in 2010, and these were actually combination of the various CPT codes. This is a table of urodynamic studies, and we see what the 2009 urodynamic CPT codes were for the various procedures, and then how they were put into compounded codes in 2010, which does still exist for 2021. Now, when we do urodynamic tests, we code and bill one primary CPT code. And we're going to use either the 51726, the 51727, the 51728, or the 51729 that's going to include the complex cystometrogram. And let's look at payments that we're going to get when we do urodynamic studies in 2021. We're going to bill, and we're going to rank first the CPT with the highest relative value units. What's urodynamic documentation is required. Looking at urodynamic documentation, what should be included? Let's look at this special clinical scenario. Urologist A supervises a registered nurse for technical UDS, urodynamic. Urologist B discusses with the patient later that day, the findings and gives a recommendation for treatment. And then the urologist A officially reads the urodynamics 2 days later. Harry, that's the end of my dictation. That's the end of the webinar. And thank the audience for their listening and for their attendance at this meeting. And thank you very much.